Okay, go ahead.
All right, so our presentation is what is a vertically integrated healthcare network? And it is by Bethany Chai, CJ Pasentino, and Kristen Harrison. Multi-hospital system. A multi-hospital system is two or more hospitals owned, leased, sponsored, or contract managed by a central organization. Multi-hospital systems are horizontal hospital integration systems and vertically integrated healthcare networks. They also contain acute care. They also only contain acute care facilities. They can be either for-profit or not-for-profit facilities. According to our reading this week, hospital systems can exploit economies of scale and scope, can reduce administrative costs and realize purchasing economies, and confer marketing benefits. Employers and insurers may prefer one-stop shopping, which minimize purchasers' transaction costs. So, multi-hospital systems, they use group purchasing organizations because they can get a greater discount. Benefits of a multi-hospital system. I went online and found a study by the Health Research and Educational Trust, and they studied what made these multi-hospital systems effective. And I found this article really interesting. Number one, they establish a system-wide strategic plan with measurable goals, and that includes both short-term and long-term goals, and they pursue perfection rather than improvement. And then number two, they create alignment across health systems with goals and incentives. They have oversight committees to make sure it's all organized. And then they embed individual goals within the long-term and short-term goals for each hospital. And then they set performance targets with incentives for hospital leaders. Number three, they leverage data and measurements across the organization. And number four, they standardize and spread best practices across the health system.
Okay, so examples of a multi-hospital system are the HCA, which is the Hospital Corporation of America. The HCA started in 1965 when Dr. Thomas Frist Sr. formed the first investor-owned hospital in Nashville, Tennessee. They have since grown into the largest for-profit multi-hospital system in the world. It's made up of more than 250 hospitals and freestanding surgery centers throughout the United States and the United Kingdom. As a multi-hospital system, HCA does not have a captive insurance company. The HCA treats 26 plus million people per year. There are 8.1 million emergency room visits annually. 106 of the HCA hospitals are on the Joint Commission's list of top performance on key quality measures. It has 233,000 employees, 37,000 active physicians, and 79,000 nurses. There are 150 languages and dialects that are used by HCA affiliates that deliver healthcare services.
So I'm going to talk a little bit about vertically integrated healthcare networks. And vertically integrated healthcare networks are a health delivery system in which the complete spectrum of care, including financial services, is provided within a single organization, such as a health maintenance organization. The idea is based on unified leadership, and as Kristen mentioned earlier, the costs are more effective, they're better, and the care is more advanced under a vertically integrated healthcare network. And it's also important to point out that vertically integrated healthcare networks can consist of both for-profit and not-for-profit hospitals. So who or what is involved? So by definition, a vertically integrated healthcare network has each of these systems. A has physicians who are employed or on contract to the system. B owns and or manages provider organizations. And C owns one or more captive health insurance companies. It is important to note that all vertically integrated healthcare networks are multi-hospital systems, but that not all multi-hospital systems are vertically integrated healthcare networks. The reason being is that not all multi-hospital systems operate their own health insurance companies. And two good examples of integrated healthcare networks include Intermountain Healthcare in Salt Lake City and St. John's Health System in Missouri. This is just a picture that we thought demonstrated well what a vertically integrated healthcare network is all about.
All right, so physician and insurance roles in a multi-hospital system. In a multi-hospital system, physicians are either employed by the hospital system, or they have contracts with the hospital system to perform certain services. And then a captive insurance company. This is created and wholly owned by one or more non-insurance companies to insure the risks of its owner or owners. Captives are essentially a form of self-insurance whereby the insurer is owned wholly by the insured. And then horizontally integrated networks do not have a captive insurance company, while vertically integrated networks do have an insurance company.
So examples of a vertically integrated healthcare network is one of them is the Intermountain Healthcare. Intermountain Healthcare is a not-for-profit health system that is based in Salt Lake City, Utah. It has 22 hospitals, a broad range of clinics and services, and about 1,400 employed primary and secondary care physicians at more than 185 clinics in the Intermountain Medical Group. Providers practice medicine through an integrated system where cooperative interchange between hospitals, clinics, and health plans are both rewarded and encouraged. Intermountain Healthcare operates Select Health, a captive healthcare insurance. Vertically integrated health networks have their own captive health insurance company, while multi-hospital systems do not.
There you go.
All right, great job. You guys covered that topic very well. And I wish Bethany could hear me, but she did a great job too. That was awesome that she was able to even do that without hearing. So that was great. So I ask each, every time I ask each student the same question, and I'll start with Bethany, and then, I'll start with Kristen, and then CJ, and then I'll type it into Bethany. But what was the most interesting thing that you learned as you were studying this topic?
For me, it was just really interesting learning about how hospitals work together or can work together and how it can be cheaper. Because, I mean, the insurance program or insurance is so complicated. So it was just kind of interesting to see how you can make it a little easier for insurance for different hospitals. But yeah, it was just kind of cool to see how they all work together, and it makes the whole healthcare system a lot better in the process. But yeah.
Personally, I thought just looking at the different hospitals that are multi-hospital systems or integrated healthcare networks, and just being able to see, kind of like Kristen said, how that makes it more efficient and more and helps it run easier under just one management. I think that was the most interesting thing for me, and then just basically what Kristen said.
It was interesting to learn about the captive health insurance companies because they kind of sound like they're being held hostage. it was also interesting to learn kind of the difference between the vertically integrated healthcare systems and the multi-hospital systems, because they're kind of intertwined, but yet they're two separate things.